For these young people, the COVID-19 era really has been a significant proportion of their childhoods, right? A lot of the 8-year-olds I've worked with, well, COVID has been a quarter of their life. And it's the kind of thing that'll really impact young people as they're growing up, and their perceptions of health and risk and sociality, even things like nationhood and government. And most importantly, we've really relied on children and their participation in our public health efforts. They're part of that team that have kept us all safe. But from really early on in the pandemic, I was really struck by how invisible children were in the communications from our politicians, health promotion messages, and media representations. As Janine mentioned, I was in the US for the first year and a half or so of the pandemic. And so they were particularly invisible there. But I am a childhood and medical anthropologist, so I was really looking out for well, what does all of this mean to kids? And yeah, it was just a black box. I had really no idea. And I thought that that's not really good enough when we're trying to take care of an entire nation of people, for such a large group, for their perspectives and experiences to be so invisible. These are a couple of pieces that I wrote to address some of these issues in the media, and there's still only sort of part of a handful of media articles that do even address children's perspectives at all. So this project, the Pandemic Generation Study, sought firstly to assess, am I right? How have children been represented and included or excluded in COVID-19 health measures and public policy? And then secondly, how have children experienced, perceived, and understood the pandemic and public health messaging in the context of their everyday childhoods? And thirdly, how have children participated in public health promotion? Now, the first part of this study was actually undertaken by a wonderful summer scholar, Samantha Samaniego. She came and worked with me, and she conducted a critical discourse analysis of government press conference transcripts, policy updates, and media articles from March 2020 through to April 2022. So she was looking to see, firstly, how much have children been represented? And when they have been represented, how are we thinking about and talking about children? She really confirmed my sense that children have been pretty neglected. So they're often just erased from our conception of the public, right? We saw that in the vaccination targets. A lot of the language even around vaccination targets just forgot that children are part of the population too. And often policy and media would represent the perspectives of parents or teachers or other adults, health professionals, but they'd completely leave out children, even when, I cannot advance this slide, even in matters that directly involved children, right? So this is a quote from a New Zealand Herald article. Education Minister Chris Hipkins said, he understood teachers and parents' anxiety, but he was confident reopening under alert level 3 could be done safely. So no mention of the fact that children might also have feelings about reopening schools. And when children were represented, it was often in terms of their risk, right? So particularly risk of infection, illness, educational deficits, or as risks, as disease vectors who endangered their grandparents. Or, it was the suffering children. Again, perspectives from actual children were pretty rare. And it's not that these things aren't important. It's especially as disparities are amplified. It's that taken together, they paint this very narrow picture of children that really reduces them to caricatures of risk, suffering, resilience, sometimes passive recipients of care. We haven't been asking about what matters to children, and we haven't been really talking to children or hearing from children. And we haven't been thinking about children as participants in pandemic life, right? As public health promoters, as people who engage with government and institutional mandates, co-construct what I've been calling domestic health policies at home, the way that households will set their own sorts of rules and protocols. Children have accommodated a restructuring of their childhoods, and they've contributed to the care and protection of themselves, as well as their families, communities, and nation. And this very narrow way that we're seeing children represented really reflects a general cultural construction of children, not as social actors, but as really passive recipients of care, education, and socialization. So, as a society, we tend to think of children as sort of inherently vulnerable without stopping to think about the ways that we make them vulnerable, including through our attempts to protect them that can sometimes leave them more vulnerable. And we don't tend to think of children as members of the public. We think of them as public in waiting. And we actively discourage children even from being in public spaces. Most of our public spaces are pretty adult-centered. We cordon children off into special child-friendly spaces where we don't really see them, schools and playgrounds. And we can also see a real shift in the last couple of decades towards a cultural philosophy that I think it's influenced by neoliberalism and also some American cultural values, possibly, but a cultural philosophy that sees children as the private responsibilities and business of their parent or guardian. We don't tend to think of children as society's business or people that all of us should be looking out for. And we don't tend to think about what happens when we exclude children from public and what happens to public policy when we've forgotten that children are members of the public. So the Pandemic Generation Study really aimed to reveal a different view of children. And I did this by working with 26 children aged between 7 and 11 across Tāmaki Makaurau. I initially wanted to recruit kids through schools in order to get a really diverse sample. But of course, schools were closed and then they were closed to visitors. So I ended up recruiting kids through personal networks and particularly through community Facebook groups, so targeting the local community groups for different areas across Auckland. So these kids do represent different ethnic backgrounds, but I do have to acknowledge that there's an overrepresentation of more middle-class kids, especially kids of like health or education professionals, because the recruitment strategy relied on parent gatekeepers. These were the kinds of parents who were most likely to see value for their child in participating in research amidst what was like really a very turbulent time. And so I offered parents the option of doing an in-person visit or participating over Zoom. 16 chose to participate in person with health measures in place, and 10 participated over Zoom. And what we did was, I said, we're going to make a comic story of your experience of the pandemic. And we started off by doing a bit of a brainstorm. So I would ask some questions and collect children's sort of ideas and memories and thoughts and experiences and write all those down. And then the child got to choose from their brainstorm what they would like to represent in their comic. And this choosing part, I think, is actually one of the really interesting parts of this method, because the brainstorm, which was maybe a little more similar to an interview, I was the one who was asking the questions, and the questions often reflected my agenda. But when children got to pick what they put in their comic, they often chose things that I wouldn't have chosen for them, or things that I hadn't really realized were as important. And so the method allowed children a lot more agency in order to tell their stories in their way. And kids had the choice, they could draw the comic themselves, or if they weren't super into drawing, which many kids are, they could tell the researcher, me, sometimes my summer student, Sam, what to draw. But they were the creative director, so they got to tell me exactly what to draw and how to represent it. Sometimes we did it together, sometimes drawing in the same panel, doing different bits, or they would assign me bits to draw, usually the hard bits, and we draw it together. I think it's worth just being familiar with the period of time that the study that we were carrying out this study, because it it was a time where there was a lot going on and a lot of change happening very rapidly, and that's really reflected in those comics. So this is a timeline of our pandemic adventure in New Zealand, starting with our first reported case in February 2020 through to April 2022. So you can see the different alert levels that we had during different parts. I obviously wasn't here for most of this, but we've got the purple shows the level 3 and 4 lockdowns, and then orange and red with our new traffic light framework. The big pink wave showing what happened when Omicron came to town just after that Delta wave. And we've got the vaccines as well. So the children's vaccine rollout started in mid-January. So that was right in the middle of the study period for pandemic generation. And so we can see this timeline kind of reflected in children's comics as well. So comics that happened earlier on in the study period, often children were drawing their experience of that sudden rupture that occurred for them when we went into that August lockdown, and the things that they thought were going to happen tomorrow suddenly weren't going to happen. Often kids really couldn't remember the first big lockdown that we had in March 2020. And so for them, this was the sort of big disruption. Although some of them did comment on that earlier disruption as well, but a lot of them focused on the August one. And then a bit later in the period of the study, we see a bit more of the discontinuity of lockdown, the boredom, the tedium, sometimes the fun as well, but a lot of waiting. So this is a comic by Secret Sloth, age 10. Kids picked their own pseudonyms or secret names. And so you can see that she doesn't have that rupturing event at all. Her comic just starts in the middle of lockdown. And in the last panel, she's drawing herself imagining getting her vaccine because she was booked in to get it in the next week or two. This is a comic done in early January. What I want to focus on today is the way that children's comics show how they've been excluded from our public health response. So, having accurate information for a start is a pretty important part of a public health crisis. But access to information was one area where we really see that cultural model of children as the responsibility and business of their parents. So most public health messaging was aimed at adults, and there's kind of an implicit assumption that parents are going to translate and deliver the relevant information to children. But children's comics showed what the problems with this model can be, especially because not all parents have the same kind of time or energy or resources or knowledge to have these conversations with their children. Now, some children were having really extensive and iterative conversations with their parents at the dinner table, but some kids had very few conversations at all about what was happening. And Lola here, age 8, she says, Mum, why are you watching that thing? Mum says, shush, Lola. But why? Ask later. So a real story of exclusion there. And she actually told me, you're the only one I ever talk about COVID with. And like I'd talked to her twice, so it's not a lot. So children, instead, they kind of patchworked their understandings of the pandemic and health messages through bits of conversations, but they were also quite isolated. They weren't necessarily able to have conversations with people at school because of lockdown. So then it was snippets of the news, government press conferences, and the internet. Many children did talk about watching parts of that 1 p.m. press briefings. They didn't understand a lot of what was going on. The thing is that when we don't share information with kids and we don't hear their thoughts as well and sort of co-construct meaning with them, they piece together what they hear and arrive at their own conclusions. So this is a comic by Jonathan, age 8. And he said he had only just learned that COVID-19 was a disease in November. No, this is November 2021. He had heard of COVID-19, of course, but he didn't actually know what it was until he was at a funeral with and they found out there was a positive case, and he felt really confused and scared. He said, because like they said someone's positive, like a kind of tone of voice, like something's going to happen. So I got confused and I was wondering what's going to happen. So what came straight into my head was like, are we going to have to evacuate? Like, are we going to have to leave our homes? So parents might not recognize as well the need for their child to have more information, or they might have thought that they were protecting their kids. But some parents did say to me, including Jonathan's mum, said to me after I spoke with their child, oh, maybe we should have been talking to them more. Some parents were quite shocked at how little their child knew. There's another one, Mackenzie, aged 9, said that when I got tested and I was scared, I was scared I was going to get positive. Like I thought everyone dies when they get COVID. So I thought I was going to die. So, and this is, I think, a really important part of our public health approach when we're thinking about children and risk, because a big part of being a child is that children are actively trying to calibrate their risk, right? They've discovered this thing called death that can happen, but they haven't had enough experience in the world to really get a sense of how likely that is going to happen and how often. And so they're constantly, kids just talk about death all the time, but they're constantly trying to work out, what does this mean for me and my safety and my family's safety? So one thing kids really paid a lot of attention to was case numbers. There's something that was very clearly communicated in the press conferences. And so it was one of those things that they could kind of grasp, but they didn't necessarily know how to interpret those numbers or what those numbers meant for them. And so that meant that they could overestimate their risk. And then some of our public health measures also just weren't particularly child friendly. And, in the next time we have a pandemic, these are some things that we might think about, how we could tailor these a little better for children's experience. So the nose swab, a lot of children were really scared of this, and it had really bad, even traumatic experiences of that swab. Often they didn't know what was going to happen to them until it happened, and it came as a real shock. But children did feel better when healthcare workers took extra care and were really gentle with them. Another one is masks, right? Some children found they had to get used to wearing a mask. At first, a lot of kids were saying how much they hate wearing a mask. I stopped hearing that kind of thing after a few months. I think they got used to it. But many did find the mask really hot or irritating. And the thing is that most commercially available masks were designed for an adult face, and they didn't fit children well. This is a picture by Sarah, and she's very dramatically saying goodbye to her cloth mask, which she was really attached to, because she's heard the announcement on the TV that they don't recommend the cloth masks anymore. She didn't actually have a replacement for it. And then MIQ, I spoke to 5 children who had experienced MIQ, and a lot of them found that the provisions for exercise or food didn't really meet their needs. Oh, I've put the wrong picture on here. This isn't MIQ at all. But I can tell you that kids really struggled with having to walk around in circles, and they weren't allowed to run. There often wasn't a lot of space for them. And it was especially difficult for children with disabilities like ADHD. And then children's social needs during lockdown weren't well considered either. And this is something that we saw almost no mention of in the media reports or from politicians, apart from maybe some generic references to mental health. But what I really heard from kids was how lonely and isolated they had been. And the thing is that children really had to rely on parents to broker social connections for them, right? Because families don't have landlines anymore, and children had much less power and access to means of social connection. And we're a very parenting focused society, so I think we tend to underestimate how important children's friendships are for their well-being. And again, that model of thinking, well, children's needs are their parents' business, without really thinking that maybe parents themselves don't even recognize their children's social needs outside the household. And loneliness was especially a problem for older children who didn't have siblings, or whose siblings were not close in age, or whose relationship had a lot of conflict. And then when kids did return to school, they still couldn't be close to their friends. Many children didn't return to school at all, of course. or they were in different bubbles from their friends, or they couldn't get physically close like they wanted to because of social distancing. So children's comics really challenge us to ask, when we're thinking about public health, who are we usually thinking of, and where are the spaces we're thinking of? So a lot of our COVID-19 health measures were about community spaces like shops and public transit and cafes. These are the spaces, as I mentioned, where children already tend to be pretty excluded, and so it's easy to kind of forget about them. But a lot of children's work, their public health work, happened in the school domain or in the household or domestic domain. So children's stories showed how they enacted public health policy in the community, yep, but in schools. And in the house is one that was really interesting, because children tend to be very central to family life in a way that they aren't central to community life anymore anyway. So what happens is families or households, they'll translate government health measures into their own household policies and rules and protocols. It might be as simple as creating a place to keep masks so that they remember to grab it when they go out, or as complex as quarantining family members separately from others within the same household. And children were a really big part of co-constructing those domestic health policies. And another reason why it's important to think of and include children as participants in public health in their own right, and not just as the responsibility of their parents, is because children have agency, and they especially have a lot of influence over that household or domestic domain, over decision making, right? So this is Mackenzie, age 9. It's very important, the difference there. She wanted to make her comic about getting vaccinated, because for her, getting vaccinated was a really big thing that she could do, and she wanted to be vaccinated from very early on. She was there supporting her mum when her mum got vaccinated. She was there watching her 15-year-old brother get his vaccination. She finally found out that it was her turn to get vaccinated. She was the one who asked her mum if she could get a vaccine. Her mum said, "Are you sure?" Really, kind of left the decision to Mackenzie. Mackenzie said, "Yep, I really want the vaccine." So off she went and got it. And children's influence can go the other way as well. So this is Lola, the 8-year-old who only talked to me about COVID, and she convinced her mum to break lockdown rules and allow her to visit friends. And when families were breaking lockdown rules, like most often, it was for the needs of the children. There's evidence from the US showing that positive cases are more likely to occur after a child in the family had a birthday. So it's children's needs that are really central. And, children also challenge us to ask who can do public health promotion. So they could really assert themselves as public health promoters who shared information and supported the health practices of others. Often it was children, not adults, who first shared information about coronavirus or lockdowns. So in Ananya's picture here, it'll be your left, I think, there's a teacher in a class. It's actually a child who's telling the class about the new coronavirus. The teacher didn't yet know about it. And children challenge us to ask, what can health promotion look like? So recognizing children's public health practices means expanding adultist or ageist notions of what health promotion can involve. And this is something that I take really from anthropologists of childhood. They've observed that our socially constructed assumptions of children as incompetent or as people who cannot and should not contribute substantive caregiving or labor. This often means that the forms of care and work that children do can often be erased or overlooked or undervalued. Sort of in the same way, if you think about the way that work that's most often performed by women is often underpaid, just precisely because it's performed by women, right? So we don't tend to think of children's contributions to public health as important, precisely because they're made by children. So one of the things we might overlook is the way that health promotion can be really playful. Adults tend to draw these very discrete lines between what's play and what's work, but children will show that these things can be part of the same package. Play is part of health work, or you can care through play, or you can incorporate health work into play. So the first picture there, the top one is Sarah with her Germasword 2000, this cardboard sword that she constructed to keep people 6 feet away. And I thought that might just be a one-off thing, but she said, no, she's made 7 or 8 of them over the last 2 years because her younger brother keeps breaking them. So a very important part of her health practices. And then the other picture is by James. He's one of 2 children who would dress up as Ashley Bloomfield and Jacinda Ardern and deliver the day's press conference to their families. And health promotion can involve effective care, emotional support, and also just kind of creating a particular emotional affect in others. So we don't usually think of emotions as part of public health unless we're talking about mental health. But if you think about New Zealand's response to COVID-19, it's really relied on collective emotional feelings like calmness, confidence, and trust and positivity. So we all influence each other's affects or emotions to shape our health behaviors. And children have been a big part of shaping how we all feel by comforting and encouraging. When I was in MIQ, I got a really good taste of this. We have to walk around this bare grey car park with the same white lines and grey asphalt and wire fences and guards around and round in circles. But then something special happened. Children with chalk transformed this landscape into a garden, a zoo full of flowers and animals, truffalo trees. And when it rained, the chalk would wash away and the ground would refresh as a blank slate. And like flowers after a storm, colourful penguins and smiley faces and enigmatic scribbles popped up again. And it was so much nicer to walk around in circles in this landscape that children created. So often the things that are intended for children, like teddy bears and windows, or like chalk drawings, they help us all feel better and motivate us to maintain health measures that are hard, even from the margins of spaces that are not designed for them. And finally, paying attention to children's public health efforts also tells us a lot about what's important to them and where they perceive their vulnerabilities to lie. So this is Lola again. This is a poster that she made when she was 6. She just spontaneously produced it when she was overhearing adult family members discuss QR code scanning. And this ended up being sent out via WhatsApp to the whole family. So we could all get this message from Lola. And it really represents the way that children try and do influence the health of others, but also the way that children need to ensure the well-being of the people they depend on for survival. And likewise, Sarah's Germasword, this is her way of ensuring compliance with social distancing requires, but it also tells us a lot about her vulnerabilities. Sarah was one of 2 kids who I talked to who I thought, wow, like you've been really anxious about COVID-19. A lot of kids were really blasé and just kind of took it in their stride, or even a little complacent. But for Sarah, she's dressed in layers of clothing to protect herself from germs. She has the yogurt cup on her head, is the walkie-talkie that she uses to radio into the kitchen and check if anyone was there before she went and got her snack. And her mum was a nurse, so Sarah was really hypervigilant about her risk. She says stand back person that coughs 6 times at 4:56 p.m. because she would tune in to coughs and listen for them and worry about them and worry about her mother and her mother's safety. So how do we better include children in public health crises? Well, shout out to Shanti and Maritanga for putting together this really wonderfully worded set of recommendations with me. Good public policy recognises children as active members of the public by seeking children's views, ideas and concerns, acknowledging children's experiences, realities and roles within whānau, family and wider society, supporting children's understanding and need for accessible information, identifying and incorporating children's perspectives on well-being and safety when we're formulating and evaluating policies, actively engaging the enthusiasm of children to play their part in public health response and let public health responses be playful, and recognizing that whānau and family stress impacts children, and support for whānau and families means support for children. So what might it look like to design public health policy and messaging that acknowledges children's health promotion work and supports their participation? I had a go at this. And as Janine mentioned in our introduction, I collaborated with Dr. Jen Russell, and we created an update on the pandemic for kids. We started with some consultations with kids, many of whom ended up being participants in the study. We heard from them the main issues that they had questions about. A lot of it was about how they interpret information, interest in vaccinations for kids. Of course, is it going to hurt? And the big question about when the pandemic is going to end. And then we co-wrote an article for kids. And it was a really interesting exercise in lots of ways, but particularly because thinking from children's perspectives really forced us to think about problems like, what would we say to a kid who lives with an adult who doesn't want to get vaccinated? These are questions that we can avoid when we don't think about children as members of the public. And we had a huge positive response to this. This is a photo of Ruben Cosgrove reading our article sent through by his mother. So if you'd like to see more information about the study and read the full report and recommendations, it's on my website there. You can also see the full comic gallery with all 26 of the comments of the comics that children made, with a little bit of an explanation of their story with each one. And thank you to all of the kids who participated in the study. You can admire their very fun names. And a further thank you to all the support I've received, particularly Dr. Janine Wiles, Annika Anderson, Shanti Amiratunga and Alison Laversha, who provided feedback on the recommendations for the report, Samantha Samaniego, who was my summer student, and all of the lovely places that provided funding for the study. And that's me. Thank you.
Oh, kia ora, Julie, and thank you. That was a fabulous report. Thank you. There's a few people in the room here with us, and there's people on Zoom. I'm just going to throw the floor open to any questions that anyone has. You can put them in the chat or keep an eye on that, or if anyone has a question.
I do.
Yep.
I was just thinking, what can we do? I mean, I spoke with my daughter during COVID and everything, but even now, what do we do to kind of help them process it more?
Okay, so it's a question from the floor here in the room. The questioner spoke with their daughter during COVID, but the question is about what can we do now even to help them understand it more?
Yeah, I mean, I think if you're already speaking to your child, then that's awesome. I would say one thing just to check is that you're not just talking at your children, but you're talking with them and you're really hearing from them. So ask them questions as well. And, you know, not all kids are going to want to talk about the pandemic. Actually, for a lot of kids, it's kind of boring and tedious. So follow their lead on that one. And just also be aware that once is not usually enough for kids, because they're growing and developing really rapidly, and they're like, even just the pandemic it's causing so many changes so quickly. And so they're constantly processing this and sort of reconstructing their ideas of like, what is normal and what is a disruption and what is a normal disruption. And so having repeated conversations can help kind of iteratively build those understandings and yeah, so that children can feel more secure in this changing world.
Can I ask a question? But it's actually, first of all, Julie, that's just absolutely fabulous. I think just in case anyone doesn't realize, a lot of the artwork, apart from what the children had done, I think is Julie. She's just amazing in her creativity, and Julie, just the insights you've shared. I'm blown away. I think we could have had this right at the outset. I guess that's the point you're making. I mean, it's in some ways, the saddest part of this is that this kind of attention and awareness has come so late in the piece. Of course, we don't know how many more years we will live or not live with the pandemic, but it does seem like it's such a long time coming. A question I guess I have for you, Julie, is in terms of what message we would leave behind. One thing I remembered, soon after the Christchurch earthquake, there was a website actually that was developed by Baruch, and this is Sundla Mehta, who's actually one of the public health physicians who's worked at the School of Population Health, her husband, and there's a group of people who got together with kids and developed a website that they could, I think it was called JoJo's something or other, Jojo, not Jojo's Rabbit, but something else. I'm thinking of like a Righteous movie, but it was Jojo is in there. But the thing that I remember was it had multiple ways in which children of different age groups could access information that was tailored for their developmental period as well. So I mean, you had a reasonably broad range of age, but I mean, there's what could have been done better, apart from obviously the thing we needed to hear in the rhetoric, in the public discourse, as well as what you're hoping for now, families, parents, caregivers all take for granted, which is hearing, listening, and engaging children. But what at a policy level could have been planned and thought of so that there is information and opportunity to engage to the extent that children want to, that's developmentally appropriate?
Yeah, I mean, and I think there were a few resources out there. I don't want to say that there weren't any. I know Kids Health has some and things. I think one of the problems is that kids aren't necessarily going to go out and look for those resources. They might Google something, and it would be good to have that very, very findable, but often it's stuff that they're picking up from other places. A lot of them talked about YouTube videos and things like that popping up. So I guess I would probably suggest maybe thinking about how we can not think about children as a separate group that necessarily needs a separate set of resources, but as part of a wider collective, and how we can integrate resources in a way that they'll be able to come across them, or parents will be able to come across them without necessarily having to go and search for them. So just an example that I was thinking of would be just as simple as like when we had those 1 p.m. press briefings, which, like, I know initially they were meant to be for the press, and then sort of the whole rest of the country jumped in on them. They were such a good way of communicating with the public, though, and everyone knew about them. And I even watched them from the United States, and kids were watching them, but kids were never mentioned. Hey, like, imagine if we had a part of that briefing that was the time for kids, even just like a minute. It just so that we're not segregating children or treating them as a separate group, but we're integrating our messages to them, so that even adults are seeing those messages and thinking about children, right? So that we're reminded of children rather than continue to forget them.
Well, not just in case there's no, but I guess I would like to know if it has forced any conversations about death, for instance, and with little kids and parents having to confront this conversation about death and dying.
So could you hear that? I'll just repeat it.
Something about death.
There's a question from the floor about whether it's forced any conversations about death, for example, and parents having to confront that conversation, having that conversation with children.
So I didn't hear of anyone who was having a conversation with their children about death, but I also wouldn't necessarily expect to, because talking to children about death feels so taboo to a lot of parents. And, with the best intentions, parents want to protect their children. And so often, even some of the parenting advice that was coming through was like, don't scare your children, like don't share that you're feeling fearful or anxious yourself. One of the problems with this, though, is that it does tend to almost gaslight kids a little bit, like they can tell something's up. But then if everybody is sending them a message like, oh no, nothing's happening, it can be really confusing for children. And then I don't think that it's not necessarily a bad thing to talk to kids about death. Kids are actually obsessed with death. When I talk to kids, they talk about death all the time. They're talking about who died, how they died, what can kill you. And so if you think about even 50, 100 years ago, or if you think about across cultures, right? Death is so present in so many children's lives, in so many parts, all throughout history and in different parts of the world, including New Zealand, right? Death avoidance is a very Pākehā kind of cultural construct when it comes to children. And so I don't think it's a problem for children to hear about death. In fact, it's actually quite useful for them because it can be reassuring to know that you can talk about this and that your parent isn't going to be uncomfortable. As I said, children are trying to calibrate their risk as well. And that's why they talk about death so much. They're trying to figure out what's the likelihood that I'm going to lose a parent or something. And so the more information that they have about that, the less of a mysterious, confusing, scary thing death can be, and the more it can just be a normal part of life.
Hi, it's Jacinta here.
Kia ora.
Hi. Sorry to scare you earlier, Julie, with the time and everything. But I was really interested. So firstly, fantastic presentation, and would love to talk to you afterwards about, kind of Pacific children's representation in this. But I was really curious about the child whose mum was a nurse. And in my PhD, I'm certainly also encouraging the whole, relationship between parent and child and being a lot more open and transparent. And I love the concept of child agency. At what point do we perhaps need to think about the balance of perhaps sharing too much, or perhaps thinking about the impact that some information might have on children's ability to cope with the information? Yeah, in a way that perhaps doesn't overwhelm them or cause them too much anxiety. Is there, do you have any thoughts on that?
Yeah, that's such a good question. I mean, this is something I think about a lot, because I think that while we've swung very far in one extreme, we overprotect kids a lot, and try and sort of shield them. And there are problems with that, because often children find out this information anyway, but then they're kind of coping with it on their own. But on the other hand, we have put children in a position in society where they have very little power. They are very dependent on usually their immediate parents for survival, in a way that across different cultures and over different times in history hasn't been the case. Children historically have had a lot more of a community to rely on than in today's sort of very nuclear family oriented culture. And so when we're putting children in this very vulnerable position, and then on top of this telling them that these people that you rely on might actually be in danger, that's a really big deal as well. That's really scary. I guess I would never want to say don't tell kids the truth. And kids want to know the truth, right? I would talk to kids about this and say, some parents think that they want to protect you and not tell you too much information in case you get scared. And they would always be like, maybe for younger kids, but I'm quite old now at age 8. And so I would really want to know, because it will influence what I do. And, I want to make sure that I'm able to keep myself safe. So I guess where I'm coming to is maybe it's something that we can feel through relationship with the child, rather than putting a kind of blanket, do this or don't do this. Build relationships with the children so that you can have conversations and explore their responses to what you're saying, and reassure them when needed and back off when needed. And also realize that sometimes children don't like to talk that much, because it gets a bit boring as well, and they want to go and play, and that's fine too. Yeah, but yeah, it's certainly a question that I mull over a lot. I know that I tend to be biased in one direction, and that there are sometimes good reasons why we want to be a little bit cautious about that too.
Julie, there's a question from the floor here. See if this
Peter Adams here. I was wondering about your use of the cartoons as a mechanism for younger people to talk, to express their experiences to older people and to policymakers. I just wondered a few thoughts around how cartoons might be used as a device also for communicating between children, like within their own communities. And I guess some of the ideas I was thinking is potentially a website that facilitates that sort of a whiteboard or some way of doing it, or whether in schools there could be exercises that might facilitate that form of communication. So really between children rather than as a way of breaking adult-centric ways of thinking.
Yeah, I think I caught most of it. And I love the idea of using comics as a way of children sharing their stories with each other as well as informing us. And I think, like, hopefully some of that will happen. I certainly created a slide deck. I mean, all of the children's stories, comics got published on the website, and all of the kids in the study got sent the link, so kids can see them there. And I also created a slideshow of the study findings for kids that showed some of their stories as well. And then I think the Kia Kids News is picking up on it, and they're really integrated in schools. And so hopefully it'll get disseminated that way as well. So that's sort of with this specific project. But, you know, comics are, I think you're right that comics are a really great medium for sharing stories to anyone, but especially to kids. I think one of the reasons maybe why the comics were so successful with kids was because they get to create it. There's that association with heroes with comics, right? Like, you know, the Marvel comics and all that. They get to put themselves in a narrative and be the hero of their story. And so I think, I think it would be a really effective way for them to share stories with other kids as well.
I'm just curious if you had a chance in your conversations to hear. I know there is this huge fear among adults of kids spending way too much time on the screen, but I also know that online gaming has become a way of socializing. It has become a little sites where kids can go and meet with their friends or interact with other kids and have, so the digital space also become socializing space. So if in your conversations you have heard about that, kids during the lockdown occupying perhaps more or just occupying the digital space as a way of keeping in touch with friends and schoolmates and things.
Sorry, Janine, I didn't quite catch all of that one. Can you just summarize the question for me?
I was just saying that I know there is this huge fear among adults of kids spending way too much time on the screen and playing online games and things like that. But at the same time, I know that these have been spaces where kids are occupying as a way of socializing, connecting with friends and connecting with schoolmates. And if in your conversations you've heard anything about that, perhaps during lockdown, kids making further use of these digital spaces to connect between each other.
Yeah, I kind of expected I would. I know boys in particular really like to connect over games. I wonder if my group was a little on the young side for it. So there were some kids who would have like chats with their friends over Zoom, but they relied on their parents to really set it up for them. And they might have like instant messenger or something with their friends. But there wasn't a whole lot about this kind of, I didn't get a sense of like really rich conversations that were happening online through kids, from kids. Maybe partly because parents were trying to limit their screen time. But yeah, I heard a lot more about kind of missing friends. And, you know, kids would talk about the only time they'd see their friends was like in the Google Hangouts with their school, their class, and they didn't, you know, it's not the same as sitting next to a friend for the day. So yeah, but maybe they were just a little on the young side for that. I think parents also probably quite worried about the kind of risks of online sort of unpoliced, unmediated online contact. Yeah.
I'm sure there will be more questions, but I think I'm going to wrap up the presentation for now, Julie. Thank you for an excellent presentation, and thank you to the audience, those of you here in the room and online, for your excellent questions and discussion. And yeah, thanks very much, Julie, for presenting. It's been fabulous.
Oh, thank you for coming.
Thank you, Julie.
Cheers.
Julie, I have to remind me to send you a photo. Stop the recording.